Imagine needing surgery but there is no anesthesia, no propofol, no ketamine, no spinal anesthesia, no surgery. The surgeon is ready, the instruments are prepared, but you are completely awake. For those of thousands of years, this was the reality of surgery. This is the incredible story of how humanity went from surgery without anesthesia to modern operating room surgery before anesthesia. Long before modern hospitals, ancient civilization was already performing surgery. Ancient Egyptian, Indian, Greek, Romans, and Islamic physicians developed different surgical techniques. They treat wound, fracture, abscess, and even performed procedures involving the skull. But there was one enormous problem: pain. There was no reliable way to make a patient unconscious and pain-free during major surgery. Physicians sometimes used alcohol, herbal preparation, opium, or other substances, but these methods were unpredictable. A patient could still feel severe pain, and sometimes the treatment itself could be dangerous. The age of speedy surgeon. For centuries, surgeons had one major strategy: work as fast as possible. The faster the operation, the less time the patient had to suffer. The surgeon's reputation could depend on speed. Imagine lying on the table while several people hold you down, knowing that surgeon's about to cut into your body. There was no modern monitoring, no pulse oximetry, no ECG, no ventilator, and no anesthesiologist carefully control your airway and vital signs. Surgery was often terrifying, and because of the pain, the fear, many people avoided surgery unless there was no other choice. The breakthrough. Then during the ninth surgery, something extraordinary happened. Scientists and physicians began experimenting with substances that could produce unconsciousness. One of the most important discoveries involved ether. In 1846, a public demonstration at the Massachusetts General Hospital showed that ether could allow a patient to undergo surgery without experiencing the usual extreme pain. This moment became one of the major turning points in medical history. For the first time, surgeons could operate while the patient was unconscious. Surgery no longer had to be raced against unbearable pain. It was the only beginning. Other anesthetic agents were developed, including chloroform and later many safer and more controllable drugs. Anesthesia gradually became a specialized medical field. Physicians learned how to control consciousness, pain, breathing, blood pressure, heart rates, muscle relaxation, and eventually anesthesia became much more than simply putting someone to sleep. Modern anesthesiology became a science focused on keeping patients safe before, during, and after surgery. From ether to modern operating, today an anesthetist may use medications such as propofol, ketamine, opioid, local anesthetics, and inhaled anesthetic agent depending on the procedures and the patient. But the medication are only one part of anesthesia. Modern anesthesia also depend on technology. The monitoring display oxygen saturation. The ECG shows the heart's electrical activity. Blood pressures is measured repeatedly. End-tidal carbon dioxide help us assess ventilations, and in general anesthesia, the airway can be supported and with devices such as endotracheal tubes or supraglottic airway. Behind what looks like a simple operation is an entire system designed to protect the patient. Surgery today. Today, surgeons can perform procedures that could have been unimaginable centuries ago: brain surgery, heart, spinal, abdomen, organ transplantations, minimally invasive procedure. and complex emergency operation. The operating rooms has become a place where surgery, anesthesia, nursing, technology, pharmacology, and critical care. The story of surgery is not only a story of about surgery, it is also the story of humanity's struggles against pain. The, anesthesia, and the stories of anesthesia changed surgery forever, from the patient being held down during painful operation to carefully controlled anesthesia with continuous monitoring. Medicine has traveled an extraordinary distance, and this is only the beginning. On this channel, we will explore the fascinating worlds of surgeries and basic anesthesia, explaining procedure, anesthesia concepts, medication monitoring, and the scenes behind the operating room in a simple and understandable way. Subscribe and join us. We're going behind the operating room doors because every surgeon has a story, every surgery has a story, every anesthetic has a purpose.